This video will discuss brain damage, using the historical case of Phineas P. Gage, born in July 1823, as a starting point. This case was the first widely cited in medicine to infer that brain function can alter personality. Around 1850, it was observed that Gage's injury was highly localized, damaging only the frontal cortex while sparing blood vessels, though he lost one eye. While he regained consciousness quickly, his personality and behavior were dramatically altered, exhibiting characteristics like being childlike and disinhibited. This is referred to as classic hypofrontality, common with traumatic frontal lobe injury. Contrary to earlier beliefs, he showed some, quote, social recovery before his death 12 years later. Brain damage can result from various causes, including traumatic brain injury, strokes, Alzheimer's disease, and Parkinson's disease. Note that other neurological disorders mentioned in the book will not be covered in test questions. Traumatic brain injury affects 1.4 million people each year in the United States. Causes include falls, motor vehicle crashes, being struck by or against objects, and assaults. Males are at higher risk, and the highest risk age groups are 0 to 4 and 15 to 19-year-olds. Types of traumatic brain injury include closed head injuries like concussions, contusions, and diffuse axonal injury. Coup contra coup injury involves damage at the site of impact and the opposite side of the brain. Symptoms range from acute confusion to long-term memory or sensory problems. Traumatic brain injury develops through direct mechanical injury to neurons and damage to the blood supply, which deprives neurons of nutrients. Overactivity of NMDA-type glutamate receptors leads to an inflow of too much calcium, activating death enzymes and impairing the neuron's ability to meet energy requirements, ultimately triggering cell death. Strokes are the third leading cause of adult death and involve the disruption of blood flow in the brain. Hemorrhage is bleeding, caused by a ruptured blood vessel, often from trauma or an aneurysm, which is a balloon-like weakening of the vessel wall. Ischemia occurs when blood flow to a brain region is blocked. An embolism is a blockage traveling from another part of the body. Arteriosclerosis involves fat deposits in brain blood vessels that grow and block flow. Loss of blood supply kills neurons because deprived neurons become overexcited and release glutamate, which activates NMDA receptors, and without blood supply, glutamate reuptake fails. Dementia is the deterioration of intellectual abilities, including memory, judgment, and concentration, usually accompanied by personality changes. Causes include stroke, motor diseases like Huntington's and Parkinson's, and Korsakoff syndrome. Alzheimer's disease is the leading cause of severe dementia in the US, affecting over 1% of the population, mostly those over 65. The severity and type of symptoms observed in dementias are directly related to the death of neurons in various brain regions. The exact cause of Alzheimer's disease is unknown, but we know it has a heritable genetic factor. Some patients have a specific genetic problem causing early onset disease. However, Alzheimer's is likely a term describing symptoms from various diseases causing similar brain damage. Many AD patients lack a family history or identified genetic problem. A key feature of AD is the presence of plaques, which are clumps of beta-amyloid protein found in areas of cell loss. Beta-amyloid comes from amyloid precursor protein, which is normally needed by neurons. When cleaved by enzymes into abnormal amounts, beta-amyloid clumps inside neurons, causing them to malfunction and die. Another feature of AD is tangles in neurons. Microtubules, which transport materials within the neuron, break apart and collapse into a tangled mess due to abnormal tau proteins. This disrupts normal neuron function, leading to cell death. Gross pathology in Alzheimer's disease shows enlarged ventricles and significant gray and white matter loss compared to a normal human brain. Drug treatments for dementias, such as Cognex, Aricept, Reminol, and Exelon, are acetylcholinesterase inhibitors. These enzymes break down acetylcholine, so inhibiting them increases acetylcholine in the synaptic cleft, potentially stimulating learning and memory areas. Namenda is an exception. Acetylcholinesterase inhibitors offer some improvement in daily living skills and may delay disease progression, though effects are often small and occur in a small percentage of patients. Namenda, approved for late-stage AD, works by briefly blocking the NMDA receptor, based on the theory that overactivation contributes to neuron death. These small effects can still dramatically impact quality of life. Parkinson's disease was first described in 1817 by James Parkinson. However, the condition has been recognized for thousands of years in ancient medical systems like the Ayurveda and the Chinese medical text, Neijing. Symptoms of Parkinson's disease include difficulty initiating movement, a shuffling gait, cogwheel rigidity, and resting tremor. Advanced stages can involve psychiatric complications, such as depression, hallucinations, paranoia, and cognitive decline. Parkinson's typically appears after age 40, though juvenile Parkinsonism exists. It affects 1% of people aged 50 and over, and is about 1.5 times more common in men than in women. Subtypes include primary or idiopathic PD, which is most common and of unknown origin. Secondary Parkinsonism is related to drugs, stroke, or trauma. Familial PD is genetically linked, accounting for less than 20% of diagnosed cases. The disease is often diagnosed late because symptoms only emerge after a substantial loss of dopamine. Clinical diagnosis usually occurs after 80% loss of dopamine in the basal ganglia, suggesting the disease is likely present for over 20 years before diagnosis. The mesostriatal dopamine system is critical for movement. It includes the substantia nigra, which sends dopamine to the basal ganglia. In Parkinson's disease, substantia nigra neurons die, reducing excitatory input to the basal ganglia and leading to the death of parts of the basal ganglia itself. Post-mortem analysis of a brain with Parkinson's disease shows a shrunken substantia nigra. PET scans demonstrate the loss of cellular activity in the basal ganglia in Parkinson's disease. A pathology found in Parkinson's disease is Lewy body formation. These are circular structures in the cytoplasm with a dense core of alpha-synuclein protein, which normally aids in synaptic vesicle function. Abnormality in the gene for this protein, or exposure to environmental toxins, can lead to the clumping of alpha-synuclein. Parkin abnormalities, seen in familial PD, involve a gene mutation that affects a protein responsible for tagging abnormal proteins with ubiquitin for degradation by a proteasome. Overactivity of Parkin in motor control regions can lead to excessive degradation and neuronal death. Treatment options include levodopa or L-dopa therapy, a dopamine precursor, which is effective initially but can develop on-off effects. Direct-acting dopamine receptor agonists are also used. Experimental brain surgery involves lesions to reduce inhibition, and neural tissue implants are being tested. Deep brain stimulation, or DBS, is a recent treatment. Indwelling electrodes are implanted in affected neurons, and stimulation provides a pulse that rapidly restores some control of motor activity. PET images show implantation into the right putamen, revealing continued degeneration on the left side.